it's Thursday night, and come Monday, we will have the vaccination phase 2 being unfolded across the country. The government has made the decision that for the next lot, which is those above the age of 60 or those above 45 with comorbidities, they will be eligible for a vaccination starting March 1st. Now, to understand this better and how prepared are we and how is it going to really pan out, I'm sure you have as many queries as I do. We've got a very special guest joining us right now, Dr. Randeep Guleria, Director of AIIMS, joining me right now to speak about the plan forward. Dr. Guleria, always good to have you. As we open it up, help us imagine and help us prepare ourselves. What should we expect?
So I think as we go into phase 2, there will be a big increase in the number of people being vaccinated per day. It will also be a game changer in many ways because now we will be able to reach out to the high risk groups, both those over the age of 60 and those with comorbidities over the age of 45. And with the private sector also coming in a big way, the number of vaccination centers will increase. The places where people can go and get themselves vaccinated will increase, and this will help in increasing the number of people we can vaccinate at a given point in time. And I think that will go a long way in also decreasing our mortality and also trying to further decrease the number of cases that we are seeing right now.
Well, the first question that many people who will be eligible have is, will it all be via a pre-registered move on the COVID app, or like we have right now, so certain walk-ins are allowed, or will there be other alternate options also available for registration and vaccination?
So we're looking at, I think, both. As far as I know, the government is looking at all options. One is an app-based option. The other is to really reach out to people, especially in rural India, through various NGOs and various facilities that the government has so that they can get registered and get them to the vaccination site for them to be vaccinated. And also a walk-in option where people who want to get themselves vaccinated can walk into a vaccination site with their photo identity card, and their data can there be uploaded onto the app and they can be vaccinated there, so that even those who are not tech savvy can also use the facility of getting themselves vaccinated.
Dr. Guleria, there's also, some experts who are saying that there will be a requirement perhaps for higher surveillance. So far, we were only vaccinating, healthcare workers and frontline workers. But now we're going to be focusing more on the elderly or those with comorbidities. Will we need more surveillance then?
I think what we need to do is follow the same principle that we were doing. After all, there were healthcare workers who were who were elderly and who got the vaccine. My father himself is a doctor who's practicing. He's 93 years old. He's been vaccinated, received both doses. So it's not that there were no high risk groups in the healthcare workers who didn't get themselves vaccinated. Many of them with comorbidities also got vaccinated. But the number is going to be large, and logistically it's going to be a challenge because we'll have more and more centers. So I think we need to work on a strategy that each center has facilities for managing any side effects, the acute effects or the after vaccination, after immunization which happens, and therefore facilities for any allergic reaction which happens should be there in all the vaccination sites, and a mechanism that if someone is sick, there is a nearby hospital where he or she can be shifted. That needs to be developed because now the number of vaccination sites will increase tremendously. But I think there has been a lot of confidence in the first phase that we did in terms of healthcare workers and frontline workers. And with that confidence, we need to roll it out to more and more centers so that a larger number of people, both in rural and urban India, can get vaccinated, especially those above the age of 60.
Since you mentioned opening up more vaccination centers, so far the government has said 10,000 government centers, 20,000 private hospital centers. Is that to begin with, and will we ramp up more from here? Then what is the rough timeline? 12 crore people possibly eligible for phase 2. What timeline are we looking at?
So I think that will depend on two factors. One is how we can ramp up our capacity, both in the private sector. Can we also involve industry? So various industries where there are a large number of employees and they have a health care center, can that also be used so that people in industries who are or their, let's say, parents who are in the high risk group can be vaccinated and thereby increasing the pool of numbers who are vaccinated? And the second thing is the capacity that we have in terms of the doses that are available. And we need to really work on the strategy to see that there are enough doses available. And remember, we need two doses, and therefore both the doses should be available at all sites so that the second dose is also given. And what is the capacity every fortnight, every month as we go ahead? With newer vaccines also coming in, there is hope that the Sputnik vaccine will also get approval and that will also enter the market. We are going to have a larger vaccine dose pool, and thereby I am confident that in the coming months, a larger number of people will get vaccinated, and this will keep on increasing both in number of based on the number of sites and the number of doses available.
No, but has there been a constraint as far as the vaccine doses are concerned? Because one of the vaccine makers has been publicly saying that they have 50 million doses. They have the capacity to ramp it up to 65 million doses by next month. So has there been a constraint that we've witnessed?
As of now, it's not been a constraint because the number that we're vaccinating is just around 1 to 2 crores. But now we're making a substantial leap. And if we are going to look at vaccinating this large number, we will need to have enough doses available. And as we go along increasing, so we may start with more than 60 years of age, but we may bring it down to then 50, depending upon the how the numbers pan out. And therefore, we must have enough doses available in the coming months to really have, let's say, 60 crore doses. If you're going to really reach the target of 30 crore people who need to be vaccinated, that means 60 crore doses. And this is more than the population of many, many countries who are having a vaccination program.
Absolutely, which is why I believe we shouldn't be looking at them when we make our own plans, because we have a whole different challenge for ourselves. But Dr. Guleria, is the portal ready to take this kind of an exponential rise in vaccination load? Even now we're getting, reports from many places that the COVID app is slow. People are punching in the data later. We're, noting it down and putting it in later. Now that we exponentially increase the number of those getting vaccinated, will the app be able to take it?
Correct. So we're going to look at various strategies of how we make the program user friendly as, let's say, at the front end, in terms of people walking in, people being able to book an appointment, and people being brought to the vaccination site and getting vaccinated if they are not tech savvy. But at the same time, all of this data has to feed into the COVID app because there has to be accountability and then we have to make sure that the doses that are delivered are given to the people who really need it. And there has been a lot of work done over the last few months as far as the app is concerned. Also, we must remember that we already have been doing things like this. For example, the universal immunization program, or let's say the election that was held. So there is a lot of groundwork which already the government has. It just needs to consolidate it and move it in towards a vaccination platform.
The other question that many people have asked us is, for those who will be paying for the vaccine, those who choose to go to a private hospital and pay for the vaccine, will they be able to choose which brand? And I'm not just talking about the two brands right now, but like you said, going forward, we're hoping there will be more brands in the market.
As of now, I don't think one will be able to choose the vaccine that we need because, like I said, there is a logistic issue and there is an availability issue. So if you are able to choose a brand and then you come back and you want this and then you change your mind, you want that, that will create a lot of logistic problems. So each area will have a particular vaccine available and people can go and get that vaccine at that site. And the second dose also has to be for the same brand that you've taken. So logistically, it will make sense that you go to the nearest site and get the vaccine that is given in that site, and you take the subsequent dose also from there on. Once we have a situation where the demand and capacity sort of meet each other, that the capacity has been ramped up a lot, and to meet the demand, then one could have a choice. The vaccine may be available off the shelf and you could just buy it from the market and get yourself vaccinated, as we do for the influenza vaccine.
Dr. Guleria, lastly, I wanted to check with you because we've had conversations with a few authorities and they say, well, right now the government is yet to come out and the centre is yet to come to us with the plan. And once the plan is with us, we will take time to prepare. It could take a while. For example, Mumbai civic body BMC says, well, we'll need 15 days from the time the government gives us the plan and then we can only start vaccinating. Now, politics aside, is it really that challenging once you have the details?
I don't think it will be very challenging. The first few days, of course, there will be teething troubles, and I'm not saying on the first day we will achieve a huge target, but we have to make a beginning. And whether we make it on the 1st of March, on the 7th of March, or 15th, we will have to make a beginning. And once we do that, gradually things will improve and we will get over whatever glitches we have. But we have to start, and I think the earlier we start, the better it is, especially considering the fact that we are seeing a little bit of spike in cases in different parts of the country. Therefore, vaccination is one way that we can really prevent this from happening. And this has been shown in various countries like Israel and even in UK. After the vaccination drive, the cases have come down, their mortality has come down, the hospitalization has come down. Therefore, this is a window of opportunity. We should not wait too long. We must start as early as possible. We will learn as we go along, and we've done this throughout the pandemic, from the lockdown to various facilities that we've created to drugs that we've given. So this strategy has to be there in the during the pandemic. We can't wait for everything to be ideal and then say we will roll it out. We must start as early as possible.
Yeah, and definitely in a state like Maharashtra, or for that matter, even in a state like, in a city like Mumbai, where we are now looking at 1,000 cases every day, we cannot afford to slow it down or, take our own time to roll out the next phase. Thank you, Dr. Guleria, for answering my questions and really sharing all of that information for us. Helps us also prepare better and know better where we are headed. Of course, we are waiting for the government to come out with the detailed set of guidelines in a couple of days. We don't have much time because this is supposed to start on Monday, but we will know what will be the pricing for the vaccine that people will have to pay if you're not part of those eligible for the free government vaccination at the government hospitals. And if you choose to go the other way, what will be the criteria? What will be the pricing? All of those details are awaited. But there you go, some more insights into what happens starting March 1st. Completely out of time. Thank you so much for joining us on this conversation.